Hello, this is Mike with Health Agents Network in collaboration with Bankers Fidelity, and this is the recorded version of retention processes, keeping clients and prospects on the front line. Now, your business is another agent's prospect. I'm sure you've never walked into a prospect's house and said, you know what? You have an agent? Great. Call them and I'll see myself out. No, you're there to convert that prospect into one of your clients, just like other agents are looking to convert your clients into their own. So we will make sure that our clients are staying our clients and not becoming someone else's. So this is one of the key areas of success for insurance agents is retention and keeping clients your clients. We are paid residual income to help our clients out, but we also don't want to see that residual income go away because they chose another agent. So how do we do this? First, we have to organize our data to make sure that we have ample information to keep our clients our clients. Of course, as it becomes a matter of how we're going to organize all this. Is it going to be through a CRM, a spreadsheet, paper files, or you just hope to remember information? Part of the retention process is reaching out to your clients during various events or time frames, and you need accurate information to do this. There's an old saying, garbage in equals garbage out. If you're not using an effective system, you can't expect to have effective results. Now, in the notes section, you'll see various CRMs that you could use with various price ranges depending on what you're needing. Now, sometimes, unfortunately, this is trial and error to see which CRM you like, but a lot of them have free trials that you could use. But it's important to keep track of important information to help keep you on top of mind. So, what are we going to keep track of? Well, we need to keep track of what kind of policy or plan they have, even if they're just prospects. We need to make sure that when these changes happen to their policies, that we're there to help them proactively and not hoping they call us. This could be for market changes, whether a carrier is leaving or coming to the area. Network increases and decreases, especially relevant on Medicare Advantage plans, which rely on networks. As these networks expand or contract, we have to be aware for our clients. Of course, premium changes is a main factor in changing plans. If there's a huge premium spike with another carrier, it's a good time to come in and help clients save money. Sometimes with benefit reductions. What if a Medicare Advantage plan has a reduction in benefits? You want to be there to help your clients out. And of course, additional benefits. You may have a carrier in your arsenal that has new benefits that come to the market, and you want to be able to tell your clients and prospects about these new benefits. With Bankers Fidelity, they have additional benefits beyond just offering Medicare supplements such as Script Save. They have a network of hospitals. If their clients use them, they actually save money on their premium. Gym memberships and discounts. You'll be able to download this PDF of various discounts and benefits of using Bankers Fidelity. But this could really be a differentiator from you to another agent. If another agent's just offering Plan G and that's it, but you're offering Plan G with additional benefits, even though you might be a couple dollars higher, it still may be a deciding factor to say, you know what, well, I get discounts on hearing, on vision, and a fitness membership. Great. I'd rather have that because I may save $20, $30 a month and only spend $2 more in premiums, so on and so forth. Of course, this will vary by area. Other information to keep track of. Birthdays. Who doesn't love a birthday card? But also for spouses. If they're aging into Medicare in a couple years or a handful of months, you want to be the one that's calling them to say, hey, I know we talked before, and I know you're aging into Medicare. Let's sit down and talk. Email addresses. Add them to your email list. For a long time, a lot of agents didn't do newsletters because the cost of printing and mailing and all that became very expensive. But now, with email newsletters, you can save a lot of time and money and keep in front of your clients with an email newsletter. And social media, connect. Look them up on Facebook and connect with them. And put a quick post, of course, with their permission. Hey, Sally, it was great meeting with you today. I'm glad to take care of your insurance needs. Look forward to being your agent for a long time. Now, as you tag your clients in that, they will see that. And, of course, all their friends would see that as well. So once you leave the home, what happens? This is the important part of the retention is the process. What follow-up mechanisms do you have in place to make sure your clients stay yours? How many contacts do you have per year with your book of business? Is it 1, 2? For a lot of agents, it's 0. They go in there, write the policy, and no more connections. So you want to make sure you're not doing that. Now, one example is a thank you card. I worked for a large carrier in Kansas City, and as we turned in applications, we were required to have a thank you card handwritten with the application. This gave us an immediate contact, and who doesn't like a handwritten thank you card? We'd send in the application, put them in the CRM, put a follow-up appointment in the calendar. You want to make sure that you set that appointment before you leave, but if you don't, set up a follow-up phone call. Add their email to a newsletter and look them up on Facebook. These are all things you could do for minimal costs and have great retention, because it's far more effective to keep your client than to constantly replace them with new clients. It's very expensive to do that. Now, on a side note, if you are recruiting agents, it's just as important to have a process. This will make you look far more professional than a lot of other agencies. So here's some examples of things you have to consider when hiring a new agent. It's interviewing the agent, background check, licensing, contract, and so on and so forth. The more processes you have in place, the more success you will have, not only in gathering new clients, but gathering new agents as well. Here's a sample follow-up schedule you could use with your clients. Now, right after the appointment, write a thank you card. Within 2 days, do a Facebook friend and post with them. 2 weeks out, send them an email. Have you received your new card yet? Is there anything you don't understand that you received? And so on and so forth. 4 weeks out, maybe follow up with a phone call. Hey, just want to make sure everything I said is happening. Do you have any questions? 4 to 5 months out, maybe a personalized letter, maybe a solicitation, that's okay, but something with your name on it to help keep you, top of mind. And of course, AEP plan to contact them and review plans and any changes coming for the next year. Now, your schedule, of course, may vary depending on what method you use, but again, the more process you have in place, the more you'll do it and the more success you'll have. Because not having a process in place is a recipe for distancing yourself from your clients and inviting new agents to pick up where you left off. So remember, the end of the appointment is the beginning of a relationship. You don't want to start with a relationship by seeing them once and never seeing them again. That's not a relationship, that's a quick meeting. You want to build a relationship, which of course will build residual income. So for more information about this and other opportunities, you can visit healthagentsnetwork.com or Bankers Fidelity online.